Welcome everyone to our closing plenary. Now you know I gotta say in the beginning, it's our closing plenary, but of course sessions will go on afterwards. Please, if you can, stay until the joyous end, enjoying all of the things that we have to offer here. But in the meantime, I am delighted to introduce our closing plenary keynote address. Now before I begin, I have to say that if you were expecting a regular keynote address, you are in for a treat, because you're going to have something a little bit different. And so let me tell you this. Our esteemed speaker has said that he will give some introductory remarks, some food for thought, and then we will open the floor up for a dialogue and conversation. So as we go forward, I want you to be thinking about that, because as you're about to see, this is a person to speak to talk to, and this was his idea. He wants to hear your ideas. He wants to know. He wants this to be an exchange that begins here and goes forward. So who are we going to hear from, and who are you going to talk with and interact with? Dr. Paulin Basinga leads the Bill and Melinda Gates Foundation's work across the African continent. He brings extensive experience gained through his country and global level engagements. Before this role, he held the position of the Foundation's Global Director of Program Advocacy and Communications based in Seattle. In this role, he orchestrated strategic advocacy initiatives and forged valuable partnerships with advocacy teams in Southeast Asia and Africa. Before his role with PAC, Paulin served as the Foundation's Director of Health for Africa, leading a dedicated team in devising and implementing comprehensive country plans to advance health priorities across the continent. As the Foundation's country level in Nigeria, Paulin revitalized critical partnerships and advanced health, nutrition, agriculture, gender, and financial inclusion priorities, aligning them with the Nigerian government's human capital development agenda. Paulin's journey with the Foundation began in 2012 as Senior Program Officer on the HIV team. Here he worked on the HIV Efficiency and Effectiveness Initiative, pioneering strategies to maximize the impact of the Foundation's investments in combating HIV/AIDS. Subsequently, he transitioned to the Integrated Delivery Team, overseeing investments in community and child health before assuming the role of Deputy Director of the country's primary health initiative team, covering Ethiopia, Nigeria, Senegal, Burkina Faso, and other countries. In 2015, he was seconded to Rwanda to assume the pivotal role as Senior Advisor to the Rwandan Biomedical Center within the Rwandan Ministry of Health. During this tenure, he provided crucial decision support for health sector reforms in Rwanda. Before joining the Foundation, Paulin served as Deputy Director of Research at the National University of Rwanda School of Public Health. Here he led groundbreaking research initiatives addressing HIV/AIDS, tuberculosis, and maternal and child health, contributing significantly to efforts to strengthen Rwandans' healthcare systems. Paulin holds a medical degree from the National University of Rwanda, complemented by a master's degree and PhD in international development from right here at Tulane University. Dr. Basinga, welcome back home to New Orleans. Welcome to your other home here in the ASTMH. We look forward to hearing your remarks and then engaging with you on how we can go forward to help you in all that you're doing. Please come and take the stage.
Good morning. Thank you very, very much, Linnie, for this warm introduction. I'm so pleased to be here. So today I'm going to provide some key remarks. But before that, let me just say how I want to really thank the organizers for the opportunity to close out this year meeting. It's a privilege to be here today in New Orleans, a city that holds a special significance for me as a Tulane alumni. So you can see me here presenting my thesis back in 2009. And I made my presentation here, but I've never been back. This is the first time that I came back after almost 15 years. But I've been in touch with my colleagues here because after that, this opportunity sent me to a lot of work in global health, and I'm so pleased to be back today. I remember my days at Tulane fondly, from the unique and vibrant energy of this city, for the sound and delicious smell of Crowfest in the spring, and the Mardi Gras and everything that goes with this amazing community. I also remember the hard time that this city has endured. I was in my second year of my master's when Hurricane Katrina hit in this city, 2005. And we had to be evacuated from this city. But when you remember how the community came together to rebuild, to work together, actually to make this city even stronger, we all learn how resilience is critical. And this is a lesson that the global health community needs to continue to learn. And I continue to come back here. I was doing a sandwich program from my home country, Rwanda, to finish my master's and complete my PhD in 2009. And everything that I learned here actually helped shape my career. So since my time at Tulane, I've had the honor of serving in various roles, from leading the HIV initiatives at the Gates Foundation Efficiency and Effectiveness Program, to working with the Rwandan government in rebuilding the Rwanda health system. And also today, as the Africa Director for the Gates Foundation, I'm really thrilled to be here and share with you some of the lessons that I've learned over the years. We have gathered here under this year annual meeting, and the theme is advancing science and building community together. From local initiative to global partnership, community has always been essential to turning science progress into real measurable impact. Across the past 2 decades of our work at the Foundation, we have witnessed the power of inclusive, cross-sectoral partnership in magnifying the effect of diagnosis, vaccine, therapeutics, and health systems. In today's increasingly complex health landscape, exacerbated by climate and humanitarian emergencies, our commitment to supporting this partnership and breaking down silos is more than critical now. But what's even more important is centering the individuals who are doing the work on the ground to deliver this partnership and their solution to communities who need them most. I've told you a little bit about my story, but let me tell you a little bit about another story. 3 weeks ago, I was in Senegal to work with my colleagues at the Gates Foundation to open our first West Africa office. And last week, we just opened our Kenya office as well, because we've realized the power of being closer to the community that we serve. And there, I met Aminata. Aminata is a nurse from Senegal. She has dedicated her life to improve health for her community. She grew up seeing the impact of epidemics like malaria, tuberculosis, and HIV on her community. In the late 90s and early 2000s, global partnership to tackle these issues were only just starting to be discussed. The Global Fund and Gavi didn't yet exist. But that didn't stop people like Aminata and others from creating partnership in their own community. One thing that struck me when I visited Aminata in her facility is that she had a group of community leaders who are part of the leadership of the health center. Because these are the people who are trusted by the community. Those are the people who actually take the innovation that we come up with here, work with research institutions to actually make sure that those interventions are trusted by the community, they're uptaken by community, and we can sustain so that we can go from input, process, to outcome, and to impact. Aminata's story is not unique in Africa. It's actually the African story. Africa is a continent with rich innovators who address local challenges while pioneering health solutions every day. Whether focusing on best-in-class local delivery of community initiative or trying scale solutions across countries, region, or continent. This is a continent in the driving seat of its own destiny. Consider, for example, the advancement in digital payments, for example. In places like DRC or Nigeria or Kenya, these systems have ensured that health workers on the front line of vaccination campaigns, like those working in eradicating polio, are paid on time. This has dramatically improved the quality and reach of these campaigns. Today, in the era of artificial intelligence and mobile health, Africa youth are at the forefront of research and technology, crafting scalable solutions to some of the world's toughest health challenges. People are turning to AI to accelerate discovery of new tools, new drugs, identify mosquito species in record time, and with limited expertise to inform surveillance effort and provide accurate, tailored health information of people in people's fingerprint to inform health decisions. And at the same time as well, we're using AI to maximize efficiency, save time in endless processes that we've been taking a lot of time to achieve. For many of those young people at the forefront of these solutions, the driver to solve these problems stem from their own lived experience. Growing up in commitment and community where diseases and limited access to healthcare were daily a reality. You know, African young people today, based on where they live and their lived experiences, they are able to craft innovative solutions. This is why global partnership from here to regions, to local universities, and to local groups is so critical. With first-hand understanding of the impact of health inequity, these bring urgency and commitment to transform health systems, developing next-generation tools that will improve outcome, not only in their own community, but in the whole country, across Africa, and globally. These innovations reflect more than a capacity to address health challenges. They offer a glimpse into future shaped by African-led scientists and technology processes that can outpace today pressing health threats, yet local innovation alone, as we all know, is not enough. This is what brought most of us here, to come and seek for global partnership. You know, for this innovation to reach their full potential, they must connect with global resources and institutions. Only by integrating grassroots innovation with the support of expertise at the global health institution can we ensure community impact that scale across borders and transcend cultural divides. I remember back in early 2000s when Gavi started and Global Fund started, et cetera, and then it was kind of the golden era of global health. There were a number of great partnerships that existed. But myself, I will not be back here at Tulane and addressing this audience if it was not the partnership that the US government had with Tulane University to work with 3 African public health schools, the School of Public Health in Rwanda, in Senegal, and the DRC. These are the opportunities that we got at that time. I barely spoke English. I did my medical school in French. I came here to start learning English and studying and recording all my statistic classes so that I can learn, I can understand, etc. So those global partnerships actually helped create the global health that we have today. This is where the role of institutions like Gavi, the Global Fund, and Global Polio Eradication Initiative come into play. As I mentioned, since the early 2000s, these institutions have been crucial in tackling disease like malaria, HIV, tuberculosis, and also other NTD initiatives to tackle non-communicable diseases, neglected tropical diseases. Working closely with government, they've delivered over 1 billion vaccines, saved 65 million lives through Global Fund-supported program, and helped 20 million people work who otherwise will have been paralyzed today. They work with nurses and frontline workers like Aminata to make sure that when she goes to work, she doesn't work alone. That she And the Senegalese families and community she supports are backed by these institutions and enabled by empowering by proven science-driven solutions that save and strengthen community health. And also those global institutions help government in Africa to ensure that while they allocate their local, like domestic budgets to support health workers, build facilities, etc., but the life-saving tools are actually procured globally in a cheap way so that we can actually maximize the impact. Another very strong initiative is demonstrated by how those partnerships drive impactful local solutions. One example is the new NET project, which collaborates with government in countries like Benin and Tanzania to study and scale up the new generation of bed nets treated with 2 insecticides. This partnership helped countries stay a step ahead of insecticide resistance in the fight to eradicate malaria. As you know, resistance is a critical issue that our community will face. This week you heard a study from Uganda that is showing that even the highest effective treatment that we have against severe malaria now is facing some level of resistance. This net prevented over 13 million malaria cases and saved more than 24,000 lives in just 4 years. This impact would not have been possible without the Global Fund, UNITAID, the US Presidential Malaria Initiative, and many, many other partners who work to actually make that possible. And the value of these global institutions extends beyond immediate interventions. They are building the resilience of health systems. They are addressing emerging health crises and the insecticide resistance I just mentioned and climate-related health threat. As we look ahead on the next year, the replenishment of this big organization is coming up, and we really want to ask the world to continue to provide that support to those global organizations, because without that pooling mechanism to support scale-up of high impactful intervention, it will be very difficult for all of us to sustain the gain that we've got over many, many years. If there is one lesson that we should carry forward from this week's discussion, is that the future of global health depends on breaking down our traditional silos. I know we have researchers, we have policymakers. It's important to have our own studies, but breaking silos is the next future of our global health. We should be really proud of the exciting work and innovation that have been highlighted this week, from the groundbreaking evidence linking climate change to rising dengue cases in Asia and in America. Just think about it. This week, we learned that 20% of the burden of dengue increase is related to high temperatures. This is the new world that we're working on. And studying these kind of issues need a multi-sectorial approach. Also, a successful Wolbachia intervention in Brazil curbing on an outbreak, to a new Uganda study that I just mentioned that is showing partial resistance to artemisinin in young African children with severe malaria. The raising pressure concern of treatment efficacy across the continent. If we lose those high efficacy interventions, it will be very challenging for us. Yet even this innovation too often reflect the silos that we've created, whether it's Mpox, Marburg virus, or malaria. Every outbreak reminds us of the importance of cross-sectorial collaboration between government, NGO, academia, the private sector, and crucially, communities. You've seen recently, I'm from Rwanda, I've been very, very closely following the Marburg outbreak in Rwanda, and how the government, civil society, everyone came together to actually show an evidence-based response, how you can actually stop the outbreak as soon as possible. After all, infectious diseases do not respect borders. We've seen it, and neither should our solutions. When we approach the implementation of this incredible scientific advancement as a global community, we can do incredible things. Some of the most promising innovation stem from collaboration like the Pan-TB collaboration, which brings together partners from academia, philanthropy, biotech, and pharma to accelerate new treatment for TB. Similarly, collaboration targeting neglected tropical diseases on NTD have led remarkable progress. Collaboration targeting NTDs have contributed to 54 countries eliminating at least one NTD. This progress would not have been possible without pharmaceutical company drugs donating program, which has supplied countries with more than 17 billion free or low-cost dose on NTD medicine for decades. And that did not touch their bottom line. They've done amazing donation that have saved millions of lives, helped most of the countries to eradicate at least NTDs. As more countries reach the final stage of NTD elimination initiative, like the Reaching the Last Mile funds, unite government, funders, and technical experts to support ambitious last mile interventions. In 6 years, Reaching Last Mile has helped Senegal and Niger reach the cusp of onchocerciasis elimination, a disease that once blended the entire community there. Such partnership exemplifies the power of global collaboration to create community and deliver solutions for diseases that disproportionately impact low and middle-income countries. We want community nurses and frontline workers like Aminata to have access to preventive tools, diagnosis, and treatment they need to help their patients. To do so, we must make sure that we include them in our global community of change makers. In addition to supporting global health institutions like Gavi, the Global Fund, and the Global Polio Eradication, the Gates Foundation actively supports research and innovation in Africa. And we do our best to try to maximize the possibility that the researchers in the global north that have access to most funding can also find other researchers that are located in Africa, so that the partnership that we have, it's not based only of people who are able to make it here in those conferences, or people who went with you in schools, or people that you can discover through other partnership, so that we can actually realize that we have 55 countries in Africa, and we have many African institutions, universities, and research organizations. This is why we've been working with the African Population Health Research Center to support their great initiative to actually create a database of all African institutions that are doing research in global health, so that when you can go into that website, you'll be able to find organizations, their website, their publication, their researchers, their email address, etc. So please, I encourage you to scan the website and identify opportunity to partner with those organizations and to reach out to APHRC for additional information. The more you can access that website, the more you can give them feedback. It will be really great to actually maximize those impacts. The challenge that we face in global health are immense. And they, actually, if you look at the world today, the macroeconomic situation is very challenging. When you talk to Africa Minister of Health, when they go to cabinet, they are discussing with their Minister of Finance the macroeconomic impacts that came out during COVID time is impacting African countries in a big way. Many African countries are paying more in servicing their debt, paying interest rate, than they are putting into their health budget or education budget. So we're living really in a very, very challenging time. There is a very real trade-off that are happening in government across the continent between investing in health or other urgent issues. This is why supporting the replenishment of Gavi and Global Fund will be very critical, so it will continue to provide that funding to countries to strengthen their system. We talk a lot about this macroeconomic and microeconomic pressure, and it's important we do. We need to understand what's behind under investment in the community we work in. But it's also important to remember that this community are face-to-face with the tangible ways in which those bigger pressure translate into local problems. We hear our community when they talk about financial pressure facing community health centers, about funding cuts, about challenge, finding staff salaries, about finding or attracting those qualified staff in the first place, or about the schools close to the health centers that are not good for their kids, and they're all moving from the rural places to the urban area where they can give their kids much better schools. Global and national work to mitigate and manage fiscal space limitation is important, but it's also important that we strengthen health systems and build resilience so that local community and community health workers are equipped to manage this real financial pressure facing their communities. We've sustained commitment to collaboration and to enable scientific advancement. I think as a scientific community, we need to really start thinking about cost of the innovation that we're putting forward. We need to look at innovation that costs less money, that are going to scale, sustain in a very cost-effective way. Now, as we wrap up this conference, I hope that you leave with a sense of both optimism and urgency. The importance of all of us working together to make sure that from global to regional, organizations like Africa CDC, UNICEF, WHO, that work to actually translate the global innovation that we all come up with into concrete policies that will really help the communities to engage and uptake those innovations and scale them for the future. I've told you a few stories here today. Aminata's story is working on the forefront of public health in life and death stake. The stories of innovation and idealists whose idea are transforming the continent, and my own stories of seeing community come together to the time of great tragedy here in this city of New Orleans, or even in my home country in Rwanda, where they've been able to really transform and build a sustainable system. But I want the next great story to be the story of someone in this room, of someone who came from the Global South to attend and make connection in this room. The solutions we've discussed this week are not just ideas. They are innovation within our grasp. But to turn them into reality, we need to recommit ourselves to fostering local innovation, supporting global collaboration, and championing the role of global health institutions. The upcoming replenishment of Gavi and Global Fund are our chances to double down on our solutions, and we hope that the biggest funder of development, the work that the US government have been doing on PEPFAR, PMI, et cetera, will continue because the impact in terms of saving lives is more than evident. The hard work that has gained us the last few decades, all the impact need to continue, but I believe that the potential of this room can build a future where these diseases are relegated to history book. I know this society has been in existence for more than 100 years, and I hope the next 100 years will be tackling other issues that will be able to actually have finished most of the infectious diseases. Thank you very much for the opportunity to join you today. We still have time?
Thank you so much for that wonderful challenge. And I know there are people out there who are going to make it a reality. But on that journey, maybe you want to ask a few questions and just solidify a little bit of that help. So please feel free to go to a mic so that we can engage in conversation. I see one of our past presidents, Julie Jacobson, is heading there. But please feel free to line up and be prepared to talk. I know there are a lot of young people out there. Now, he's expecting you to change the world. I know you can. So please get up there and let's have a conversation. Julie.
Paulin, thank you for a rousing and inspiring talk. For those of you who don't know, Paulin and I worked at the Gates Foundation for several years together. And at the Gates Foundation, it started out very central, right? And this move now to really have presence around the world and in other countries, and two new offices opening up in Africa. It's really exciting, and I'm wondering if you have some advice for us as ASTMH and the research and implementation community around tropical diseases about what this means about how we do our work and what we can expect in the future. And especially when we come to things about the replenishment for the big funds you talk about. A lot of the diseases people in this room are working on are not part of those. We are 100% in favor of those things going forward, but what do we do about some of these things that keep getting left behind?
Do one by one. Oh, thank you. Thank you very much, Julie. So great to see you and to see the community. She has been a big advocate for this community for a long time. No, I agree with you. I think the foundation is turning 25 years next year, in 2025. And we are quite young, a young organization. And when you turn 25, you start making some big, bold ideas. I think we started by the idea that, Bill and Melinda really thought about creating a global organization that will really work in places where there is huge market failure. They will create those global public goods, and then the community will take it up, right? And we've seen a lot of successes in one places, but also one thing that we've realized is that if you don't get closer to the community that you serve, you like context-specific solutions. So this is why the foundation has now probably 11 offices around the world, and 5 of them are in the African continent. So we have offices in Ethiopia, Nigeria, as our deep engagement country, and then we have 3 sub-regional offices in South Africa, Kenya, and Senegal. So we'll be able to actually cover there. So we are really a global organization. We'll continue to have most of our program offices based in Seattle or DC in London, but at the same time, a growing presence on the continent so that we can actually tag team and really make sure that we provide solutions. To your point about Gavi, Global Fund, PMI, et cetera, I think the tropical diseases that you all facilitate here, support to eradicate, those are, I think you've done an amazing job to actually position them as a job that can be done. Like if you put resources, you put innovation, you accelerate implementation, you can, continue to be done. This is why, fund like the END Fund, this is why the foundation continue actually to really push advocacy, to even bring more people into, to inspire more, private philanthropists. There may be some philanthropists that want to pick one specific issue, drive the implementation of that. So we'll continue to really strengthen the advocacy of NTD globally and across Africa. As you know, we just brought Toko to the foundation. She's now a deputy director in terms of advocacy across Africa. So you have a champion within the foundation who will also continue to work with our teams there.
Dr. Basinga, thank you so much for this very thoughtful and really inspiring discussion. So you spoke about Artemisinin partial resistance, and in the research community...
Could everyone introduce himself?
Oh,
At least
okay.
be on first name basis.
All right, David Fiddock from Columbia University. I'm the incoming president following in the giant steps of Linnie Golightly. So you spoke about artemisinin partial resistance and the concern that has if we lose Coartem as a therapy. And in the malaria research community, we're really having a broad call to action, advocating as much as possible for effective change. The Global Malaria Program is soon to release a report that will advocate for changes for the adoption of multiple first-line therapies across Africa, with no more than a single product being 65% or more of the national market. So given that there's this call for a very broad change of first-line therapies for malaria across the continent, what do you see as the sort of path for that to take effect and the challenges?
Thank you very much, David. So this is where global community researchers and WHO and others working with national government and local scientists come to play, right? Because this is where silo doesn't work anymore, right? Because those are big decisions that are backed by data that you actually need to have partners in countries, not only working with the Ministry of Health, but also partners with the local School of Public Health. Because in many governments, Because malaria, if you fix it in few countries, if you don't actually harmonize those policies across many countries, you are not going to actually have the impact that you are seeking. This is why, cross partnership with local schools of public health, that will actually be contracted or asked by the Minister of Health to actually review the global evidence or write the policy is so critical. So having a critical mass of multi-sectorial people who are actually engaged to actually look at the problem of malaria, not as a top-down decision that the Global Malaria Program is giving countries to just change a policy, for them to really understand what are the impact of malaria. Like if we lose the effectiveness of Coartem, the impact on the economy of the country. Because if someone has severe malaria or even malaria, it's a 1 week of job that they are losing, etc. And then the cost of even treating the patient, etc. The cost to the health system. So I think trying to build that case for policy change in a more broader perspective and bringing more partners, I think it can happen.
Thank you. Let's go to the mic over here to my left.
Hi, my name is Lisa Stockdale. I'm from Oxford University. And the context for my question is that I'm an immunologist working on malaria vaccine immunology with lots of partners in the global south. And one thing that I've noticed is that it's incredibly difficult to actually get reagents and consumables out to researchers in those countries to enable them to do the research that we're doing in the global north, but we're asking them to ship their samples to us. I don't feel like that's a sustainable option, and that's not in the capacity building time that we would like to be living in. So I just wonder if you have any ideas on how we can fix that with suppliers, for example.
Thank you very much. This is a very, very critical question, and I wish I had an answer direct, but I'll share some thoughts. When you look at the network of clinical trials and capability that exists, there are amazing networks that exist in Europe, in America, in Latin America, and India, and it's building up in Africa. And we all need to collaboratively work together to strengthen those networks within Africa. It starts with the basic knowledge transfer. I think our universities and research organizations are doing great job. You have great universities in Uganda, Makerere, Kemri in Kenya, and other great universities. And then number two, to your point, is actually if the African Union program to establish African Medicine Agency, AMA, I think that will really facilitate regulatory to make sure that government understands the impact of building regulatory and processes that allow product from global north to come to Africa, so that you can give it some privileges to ensure that you can move products very easily, and there are not regulations that are fixing that. One of the things that the Gates Foundation is working on as well is to create an Africa clinical trial network, so that we can actually create and support clinical trials that are always on and ready to engage. I think this is something that down the road probably will solve this issue.
Excellent point. Thank you so much. Microphone here to my right.
Thank you very much for the presentation. I'm Alan Brooks with Bridges to Development, and I particularly appreciated that you took us back to the late 90s and year 2000 and reminded us about how far things have progressed, have advanced. The effect on child health, et cetera, is absolutely amazing, absolutely amazing. And yet, when I look at the data, I see a plateauing, I see a stagnating, I see a backsliding in some cases from the 2017 to 2020 period that's kind of continuing. Incident TB cases, immunization coverage, malaria cases, et cetera. So I guess my question for you is, why is that happening? Why are we seeing this plateauing or stagnating from your perspective, if you agree we are seeing that? And secondly, kind of what can Gates do? What will Gates do differently going forward to help address that? And what should the collective we be doing also in terms of our part to help change course and get us back on track? Thank you.
Wow, thank you very much, Alan. This is a question that we're battling with at the Gates Foundation and also global community. When you look at the data, you can just pick one indicator, which is under 5 mortality rate. In the past years, since the golden moment of global health, we've halved the under 5 mortality rate, and it's then, since 2017-18 plateau. There are COVID that came in, the global macroeconomic situation, etc. But also there is a little bit of fatigue in the global health community. We just need to pause and actually, try to bring global health back into the agenda, trying to recreate that moment. It will be a little bit difficult given how many challenges are out in the world today, but I think next year is actually an opportunity for all of us to think critically about what are the things that we'll do differently. And it's just to think about the next phase of multilateralism. So how do we make those global partnerships connect with local innovation better? How do we bring head of state decision makers to actually understand that they can win elections by showing impact on some tangible result on underfed mortality, child mortality, maternal mortality, etc. It's not easy, but I think as a community, we just need to pause and think about how to do things a little bit differently. Because we've been probably operating since that movement of the past few years, but this is a turning point. As we even look at, on average today in Africa, underfed mortality is around 100. 80 to 100 per 1,000 deaths. But the target for SDG 2030 is 25. I don't know if we'll be able to achieve that target. So it's really a critical moment for us as a world to actually rethink our mode. I don't have a direct answer, but we definitely as a foundation, as we hit the 25th anniversary, we're thinking a lot about it. And we hope that to announce how the Gates Foundation will be approaching that sometime next year.
To my left.
Tom Ewell, University of Wisconsin. Thank you very much for an inspiring and challenging talk. Thinking about the challenge you gave to us to work between sectors, we'll get down to the need to have people within those sectors who know how to interact with each other. That often means to be able to interact with other disciplines. When I think our training programs in the universities tend to focus our students and postdocs on an ever specialized area, and the challenge is also to sensitize them to realize that there's a world outside of the four walls of their laboratory, and then to learn to interact that way. And that's a difficult balance. I think the good news is that here in ASTMH, we do that pretty well. I think we really do subscribe to the notion of One Health. I just hope we don't lose that capability to interact outside of our disciplines to be able to address problems that can't be solved by a single highly specialized area alone.
That's a comment, Tom. I don't think there is, I fully agree with you. And I'll try to challenge you a little bit as a community. I'm a trained medical doctor. I did my PhD. My PhD was on health system strengthening. But I went to school here at Tulane University. Something that really prepared me more than 20 years ago was the program that I chose, which was a master's degree in international development. At that time, we were, there were, Bill Bertrand, Nancy Mogg, some really thoughtful, folks who were thinking about multi-sectoriality. And that really shaped my career because I didn't become, a specific UCAN. I'm not saying you should not become a specialist in immunology of parasites, etc., on a very field, because we need people who can actually push the barrier of science in specific areas. But at the same time, just pausing and putting your head up a little bit to understand, when I finish this solution, how am I going to actually make sure that those solutions reach the people who need those solutions? When you go to Ministry of Health, the Ministry of Health now, they have less and less power to actually scale and sustain program. They need to work with the Ministry of Agriculture, the Ministry of Local Government, the Ministry of Finance, the Ministry of Budget and Planning, etc., to be able to actually drive. So I think starting for bringing other people with different perspective in our field will really help us to make sure that at the end of the day, the people we're trying to reach, they live in a village and they are, they have all those needs at the same time. So we also need to actually open up a little bit and engage with other people from different disciplines.
Excellent. Here to my right.
Hello, my name is Kelsey. I'm here with the 15 White Coats nonprofit organization.
Hey!
You mentioned that these global health initiatives require a collaborative effort. And so my question is, how do you recommend pre-medical students and medical students to get involved in these initiatives?
Thank you very much. I remember my time as a medical student. It's so critical to be involved very early on. I remember at that time, it was 1998, 97. You know, I was the head of the University Association Against AIDS. I think trying to really understand what is happening within your community, you know, organizing the medical students, going to the Ministry of Health to understand, you know, even to volunteer. The Global Fund, for example, they have what they call the CCM, the Country Coordinating Mechanism. They meet, you know, there are people who actually meet to, you know, review the grant, etc. Volunteering as a medical student to really understand what is happening within your country is so critical so that you can actually sometimes give pro bono. You know, I used to be the note taker in those meetings. It helped me later on in the career, etc. Because if you introduce yourself in those meetings, this is where you meet someone who is working on something and then you learn, etc. I think it just, first of all, I would say organize yourself as a medical student community and then go meet with the minister and others to understand what are different initiatives that are coming to your country, and then, you know, volunteer, give your time. Through those volunteering time, that will open up opportunity for sure.
Thank you. To my left.
Thank you. Dr. Basinga, I want to congratulate you first for representing my country. I'm from Rwanda, an academic at the University of Rwanda, so happy to see you there. Years back, you talked about the birth of global health and everything. One of the advocacy people have talked about years back was the representation of Africans at the table, not on the menu. And here you are, the face of a big foundation. I wanted you to share a bit about the journey, but most importantly, at the table. What has been the experience like? Challenges, successes? Thank you.
Murakoze, thank you. I used to work at the University of Rwanda. I would say there are a lot of opportunities for you know, Africans to be on the driving force of shaping global health. You know, for me, my own experience has been to just make sure that I use my grounded experience. So what I bring on the table, always, I go back to connecting with communities. Because if you bring that, you know, ground experience, you know, when I go to every country, the first thing that I do is to go to the market, you know, talk to the, you know, women that are in the market, go to a facility, you know, go with a community health worker when they are going to deliver services to understand. Because when you go there, you realize that in their backpack, they have all the speciality that you have. You know, they are delivering an anti-malaria, they are sanitizing for TB, for malaria, etc. When you understand that, then you do the hard work of connecting with global evidence, understanding, you know, how at the global level it works. I think when you bridge that gap, it really helps. You know, the challenge is just bridging the divide between the reality that we're living in Africa every day and the reality at the global level, because the debate is changing. You know, the priorities are changing. You know, as you can see, if you look at the global level, many governments that used to fund a lot of global development and global health, they are cutting their contribution to aid, which is quite significant because they have other priorities, etc. I think those are kind of like a big challenges for us sitting at the table, and to really continue to show that, you know, through partnership, we can actually change things. But I would say an advice for our, you know, African colleagues that are working, you know, hard work and, you know, looking at evidence, but also never forgetting where you came from, where the evidence is, where all our work actually starts. It starts at the community level.
Excellent. To my right.
Okay. My name is Millicent. I'm a PhD student in pharmaceutical microbiology at the Kwame Nkrumah University of Science and Technology, Ghana. So I think it's no news that in Africa we are highly under-resourced and we barely get opportunities to have partnership or collaborations with other universities out here. Here is a case we would also want to develop so much as scientists. We don't want to be stuck with the theoretical aspect of science. We would want to also engage in the practical aspects of science. And just as the lady rightfully said, if you are lucky to get a collaboration, you are asked to send your samples for others to work on, which means you just get stuck with no practical knowledge. So I would want to know if ASTMH has anything in stock for us in Africa who are into postgraduate studies. Thank you.
That's a
If
question
the
for you.
question is about ASTMH, why don't we talk afterwards? Because I don't want to take
Exactly,
time away
yeah.
from our speakers. So I'd be happy to address issues related to the society separately. So why don't we move to this mic then?
Thank you. Hi, I'm Sherry. I'm with The Lancet and very excited to be here to hear about the best science for better lives. Thank you so much for your inspirational and thought-provoking talk. My question is really about the funding system. And, Global Fund are encouraging application across different diseases. So, for instance, HIV together with TB, which goes naturally if there's co-infection. And also, us as groups trying to do our due diligence to make sure that we don't have unnecessary duplication. So I want to ask from the foundation, what's your sentiment across opportunities to avoid the global health fatigue and to leverage traction if we come together in our funding model across different diseases? And I think the opportunities can add more money and not less, so thanks.
Thank you. Thank you very much. That's a really thoughtful question. It's a question of thinking about how to keep the priority, because most donors, when you look at how money flows from specific donor budgets. You need to make sure that you don't lose that opportunity. You don't lose the ability to attract money for HIV, TB, malaria, etc., because this is how the funding structure works, because it's much easier. This is how even finding big money for health system strengthening is so difficult, because when they go to their parliament, it's very difficult to link that funding to specific increase in specific outcomes, right? So we need to be smarter to make sure that we don't lose that. But at the same time, at the country level, if we can start building a narrative that brings all those opportunities together, this is why even having some collaboration with local universities and local partners and the Ministry of Health, it helps in a big way. Because even funders want really to hear from the recipient country, how that makes sense to bring all those together. So at the Gates Foundation, we do our best to actually keep our what we call program strategic teams. We have a number of program strategic teams. This is why we're building much stronger country presences, so that the country and the program strategic team can actually work together to fund something in between the vertical and the horizontal to really maintain the funding, but also maintain some very good ways of maximizing the impact on a specific program. But at the same time, also, we advocate in a big way for let's say ODA, for the World Bank, the IDA program, because the government are actually able to borrow money to support a broader health reforms, so they can actually continue to get that money. It's not a grant, but it's quite cheap, affordable funding from the World Bank and others to actually fund most of the vertical, most of the horizontal work, while targeted funders actually continue to get the money flow.
Thank you. Here to my right.
Alexis Kamju from Cameroon. I'm the regional manager of Francophone Africa at Vestegard. And at Vestegard, we actually believe and we agree with 100% that we need to be closer to the populations we serve. Now, when I look at the number of countries where Gates Foundation has offices, 4 out of 5 are English speaking. So, as an advocate for Francophone Africa, my question is simple. Would it be possible that for the next offices to open in Africa, you prioritize Francophone countries? Let's consider DRC, for example. I know Gates Foundation is not only interested in malaria, but it's the second country with the highest burden of malaria in the world. Why not an office there? Thank you.
Merci beaucoup pour la question. Si je pouvais répondre en français, ça allait être beaucoup plus facile. Probably this is, it's a very, very important question. So, just to be clear, the Gates Foundation is a global organization. We do our best to, support the diseases and look at places where the burden is the biggest, right? So the office presence is not synonymous of only the place where we work, right? Even though we just opened our office in Senegal, but we've been working in Francophone Africa for years. When you look at the program we have, in Senegal, in Benin, in Chad, in Burkina Faso, and some grant as well in Cameroon, we also tend to be very, very critical in terms of, how we use our indirect costs, etc., because we want to maximize the dollar going to programs than setting up offices. So we don't have a plan to open another office now, but definitely a place like Cameroon will be covered by our office in Senegal and also even in Tanzania. So what we're doing more and more is actually to hire diverse staff that can understand the context, speak French, etc. Yeah.
Now, I hate to do this, but they've got these clocks going. So we're going to pause the conversation. No, yeah, you do have to sit down. But we will pause the conversation, which will be continued. Feel free to come up afterwards, and the continuation will go on when this is over. But I do have to make just a few closing remarks to the son who came home, though he's from another continent. And I find myself thinking of my mother, who was from the US South and from a farm. And she told me, go up to all those fancy universities, get all that knowledge, but keep some good common sense and use it for the people. And I don't think we have any better example of someone who came, went, got the knowledge, came back, stays back at that grand table, and yet comes and meets with the women in the market because he knows that's where the power is and that's where the knowledge is. So I want to give a sincere thank you for all you've done, for all you're doing, for all I know we're going to do with you, and in typical ASTMH fashion, I have a very heavy, wow. Can't even pick it up, crystal to give you.
Oh, thank you. Thank you very much. Thank you very much. It means a lot. Yeah.
And so again, the conversation continues. Please feel free to come up. Please feel free to go out. The knowledge begins here and goes forth. And I do, as somebody who grew up in the heartland of this country where there are silos, have to say this about a silo. It's a place where you collect the grain, you collect the seed, you collect the knowledge. And sometimes for a season, it has to be there to keep it safe. But as was mentioned, it's now time to plant. Let's all go forth to plant, to water, to grow, and I'll see you in the mighty city of Toronto, and we'll keep on going. Thank you so much. More to come.